Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. Hello everyone, I'm Prabjit from VisaAid, Director of VisaAid Immigration. Today I'm here to give you information regarding the outcome-based assessment model for offshore nurses. So in the current system, offshore nurses used to apply to AHPRA, and there was a certain process before they can apply for their permanent residence application. So first step was contacting AHPRA with their qualifications. So AHPRA used to assess their qualification, they used to assess their recency of practice, so they used to assess the quality of their qualification from their country. So in that step, if your qualification was not assessed at the level that AHPRA want, they used to give you a referral letter, which is called the referral letter to bridging program. So nurses from India, specifically from Punjab, so they used to come under this model. They used to come here to do the iron program. So iron program, the length of the iron program was approximately 3 months. So after doing the iron program, they used to go to AHPRA to get the full registration as registered nurse, and then they were eligible to apply for skills assessment, expression of interest, and then visa. So now they're changing the current model. So they're changing the current iron program model. So the new model involved 3 steps. The first step, before actually the 3 steps start, will be the web-based self-assessment. So in that self-assessment, you will be putting your details online and putting your qualifications, and then they will be checking your qualifications. Then only you can start the actual outcome-based assessment process. So that process involved 3 steps: Part A, Part 1, Part 2, and Part 3. Part 1 means they will be assessing. So part 1 is called cognitive assessment. So in this, there will be multiple choice question answers. So it will be a computer based MCQs. So it will be online. So you can do the part 1 from your home country. So you don't have to come to Australia to do part 1 assessment, the MCQs. So AHPRA said that they have arrangements with other companies. So they haven't revealed the name of the companies who will be looking after this MCQs and the OSCEs and the further program. But they have they have given the indication that it won't be run by any education providers. So it will be an independent company, but they haven't revealed the name of the company. So you can do your MCQs from your home country. So if you have cleared the part 1, so you will be eligible for part 2. So part 2 involved coming to Australia. So part 2 is like OSCE. So it will be a 1-day test. I will explain you a little bit about OSCE, because I have done my Bachelor of Nursing from Australia, and I used to be a registered nurse. So I know they have the same test for nurses who are doing Bachelor of Nursing. So this involves like drug calculation, and it involves a scenario in which a patient will be given to you, and they will give you the history of the patient, and they will give you certain tasks that you will have to do for the patients. So that will involve maybe giving a medication to the patient, and maybe giving IV antibiotics to the patient. And in that process, they will be assessing, okay, are you doing everything correctly or not? So they will be assessing you from starting to end. So you will have to make sure that you're doing everything correctly from starting to end. So in the starting, they might look at are you doing the hand hygiene or not? Are you doing all the checks or not? Are you interacting well with the patient or not? So they will be looking at number of things. So it will be it is called OSCE. So the full form is it's a behavioral assessment, and the full form is objective structural clinical exam. So it is an exam. So in a clinical setting. So once you have done that test, so you will have to come to Australia to do this test. So this test won't be available offshore. So basically for iron program, offshore nurses used to come to Australia to do the iron program. So it's a similar thing. So they will be coming to do OSCE in Australia now. Once you have finished your OSCE and successfully passed part 1 and part 2, you will be eligible for registration with AHPRA. So once you have got your registration, your normal PR process will start. So you can get your skills assessment after that and apply for your EOI and then visa. So once they have given you registration, it will come with another it will come with limitation. So you will have to do an orientation program within 6 months of getting your registration. So if you haven't done that orientation program within 6 months, they will obviously give you warning, because obviously there is a condition attached to your registration that it is mandatory to do that orientation program, and it will be mandatory for offshore nurses. They have said that it won't be a very difficult orientation program, it won't be a difficult test or something, it will be online, but it will be mandatory to do it. So basically for nurses who are coming from offshore, the process will stop after for PR perspective. So you can get the registration and start your application process. So there was a little bit of uncertainty from quite a bit of time, like what is happening with the offshore nurses, what is going to happen with the iron program. So they have said, AHPRA has made it clear that there is going to be a transitional period for people who already has letters from AHPRA with the bridging referral to bridging program. So they can use those letters until end of next year, and they may extend that period to another 6 months. So if you have a referral letter for bridging program, you can still use that letter to do the iron program and then get your registration. So basically they are starting this model from January to 2019. So they don't have the exact date yet, they don't have the exact fee structure, but they have made it clear that the fees will be obviously cheaper, because the iron program fees was quite high. So it will be cheaper than that. And they have said that they will be giving option to the new applicants from October 2019 if they want the referral letter to bridging program, or they want the letter to OBA assessment. So it will be it will be left to you, like whatever you want. So if you have the letter, iron program bridging program letter, you can still do the iron program. So they will be issuing the iron program bridging referral letters until end of December 2019, or until the new program that is coming in January, and we don't have the date yet, until that date. And as I explained, the transitional program will go for about 18 months. So after doing this assessment, you can apply for your registration and then your PR application. So the main thing here is, what I believe is, there is nothing to worry about. If you have done your bachelor's, for example, from India, and you have done a 4-year bachelor, and you have some kind of experience, you will be able to do this program. And they have mentioned that there will be education providers who will be giving coaching, but it won't be endorsed by AHPRA, who will be giving coaching for OSCE. So in the end, I would like to say there is nothing to worry about. So previously you were doing the same thing in the iron program. So now they have just changed the model. They have taken the powers from the education providers, and they have taken the charge in their own hands. So I think if you have any other questions regarding the program, because AHPRA will be putting a fact sheet online next week. So if you have any questions, you can contact our office. For now, that's it. Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh.